meeting Monday, January 28th to order. There's an agenda there in front of you. Can I have a motion, please, to approve the agenda? Councilors Niche and Forrester. We have no members of the public, so there will be no public comment. There's the consent agenda. It has council minutes for approval, the minutes of the special meeting to close on January the 26th, and the minutes of the regular meeting of January the 26th, as well as there's reports for receipt. Report from the Director of Recreation Community Services, from the Rec Department for the year end 2025, the memorandum for the Chief Administrative Officer update with regards to decriminalization of drugs in British Columbia, and a memorandum from the Chief Administrative Officer with regards to the road closure bylaw number 3664, and a drawing that makes it more clear what's taking place there. Recommendation is that all the items on the consent agenda be approved or received as requested. Councillors Cunningham and Niche, anything you want to bring highlights to? Councillor Cunningham.
The road closure drawing, I noticed that's going to be going right by the back lane to Rona that they use access now. So I'm assuming all those access points when the road goes through will be closed, or because you know that road 3rd Avenue extension going past the building is going to be right there.
Yeah, CAO Pucci.
Thank you, Mayor. So the area that's going to be closed is just sort of, let's call it the striped area. The area that is dashed is going to be a future road. That road isn't going in now. That road isn't even papered. It's just that is where a road would go in the future. So the area that is hatched out or striped is the area that is contemplated to be closed, so that there can be a road put in there the way that's laid out in the future. And when we're ready to go forward with that, we will bring that to council as a fully transparent process. Thank you.
Councillor Forster.
Thanks, Mr. Mayor. I wanted to quickly just look at the update on the decriminalization of drugs in BC.
Yeah.
With that coming into effect, the pilot is going to expire on January 31st. What types of conversations are we as a community having with Northern Health, our RCMP officers, bylaw, so that then as we do this transition, people that are using substances continue having supports put in place?
CAO Pucci.
Thank you, Mayor. I'm going to defer this to our deputy.
Deputy Miller.
Thank you. I do have a meeting on Wednesday morning, with the RCMP, and then we'll move forward with the strategy from there.
Councillor Forster.
Thank you, Mr. Mayor. Do we know if there's additional resources being shared on different, like the city website, have conversations with like the Transition House and the Transition Society, anything like that? Or is that all going to be part of that same conversation?
CAO Pucci.
Thank you, Mayor. The intention is for it to be part of that conversation. However, this is a provincial matter, so we're not necessarily going out and advising the Transition Society and those groups. What we are doing is working with the RCMP and then with Northern Health to sort of have them go and disseminate the information. Yeah, thank you.
Councillor Adey.
Along the same lines, I guess it seems to me that the work of an RCMP officer or somebody with the Transition Society in interacting with people who may be using substances, whether it's somebody who's chronic and very public, or somebody who's just an occasional user, a Friday night out type person. It seems to me that I'm thinking of the RCMP specifically, under the conditions of decriminalization, they're able to be supportive and flexible in terms of how they might handle any given situation under the terms of a system that doesn't have that luxury and has become more consequence oriented. It seems to me their work will change. Whether it becomes more difficult or not, you'd have to ask them. But I think that the nature of the change is then going to be received by the people on the street, that they're working with. I think I guess I'm making a pitch for those when we have those meetings, that we address how the interaction between the officer or the health worker and the people who are using these prohibited substances, how is that going to change, and how do we manage that change in a way that is still constructive for the people that are affected?
I note Deputy Miller taking notes, so I think that's landed. Any other comments or questions? Yes.
I was just going to offer an observation on the statistics from the
Yes.
Recreation Department. I think first it's absolutely brilliant that the pool annual scans 2024 were 33,828.
Yes.
And in 2025 there were 33,830. I want to offer commendation to the extra two people. I don't know who they were, but that's miraculous. A couple of other numbers did change quite significantly, some to the good and some the opposite, I guess. Swim lessons, 169 in 2024 to 506 in 2025. I think that's fantastic. I'm not sure what might have led to that change, but that's a significant increase in the number of people taking swim lessons and therefore becoming safer in the water. So I think that report is useful also, and I wanted to shout that out.
I could speculate on the reason for that change. I would suggest it's probably staffing, but CAO Pucci, we have the director here in the room. Could I have her speak to that?
Absolutely, Mr. Mayor.
Thank you, Mr. Mayor. So in terms of the stats for the swimming, we did focus a lot on internal training. And then we had a lot of vacancies as well. So what we did is we ran some free programming for Bronze Cross, Bronze Medallion, and life saving. And so by doing that, we enabled staff to get educated and trained, and then we were able to offer more lessons. We anticipate some of the bigger decreases. You notice in the fitness, the tracking was down, but we've been missing some tracking sheets. We don't have a recreation software that tracks as well as it should, so we're kind of in a 4-year plan on getting all of that reporting, online registration and all of that. And then same with the rec programs. We anticipate there was some tracking errors in there, but we are still kind of under investigation of some of these things. This is kind of the first year we've really been able to actually monitor trends and statistics and KPIs through the department. So we're just starting to kind of develop these kind of baseline functions.
Great. Thank you very much. Councillor Cunningham.
I thought I had a new name for a minute. I just got to congratulate the rec department, because just about every category is up. And it's, I know in this time with staff shortages and everything, that's something to be proud of.
Yeah, very good.
Thank you.
All right, thank you very much. All in favor? Any opposed? It's carried. Item number 6 is 6A is a report from the Director of Economic Development, Transportation, with regards to the business facade improvement program. Recommendation that council support the application to Northern Development Initiative Trust from the City of Prince Rupert for a grant of up to $20,000 for the business facade improvement program. Can I have a motion, please, to that effect? Councillors Cunningham and Forrester, any discussion? All in favor? Any opposed? It's carried. Council Roundtable, anything? Councillor Niche.
Just an observation. Driving past Park Avenue, seeing the newly erected cage in front of the building on 5 corners there to keep people from drinking and carrying on underneath the awning of the old Sears location. And I haven't spoken to the owner, but I would imagine his frustration with having people sitting outside his building every day doing stuff that contributes to the downfall of his building is probably the reasoning behind it. Um, and I think that maybe this is a time that we have a new officer in charge here, and maybe it's time for us to have a conversation with council, with our new officer in charge, to kind of show our frustrations as to the daily goings on of downtown Five Corners and people's frustrations with seeing the same actions every day, and that's nothing happening. It's the same garbage and drinking, and this has been going on for decades. But decades ago, people used to hide, and they used to go into the bush, and they used to drink, and they used to carry on to do what they wanted to do, and they never got into trouble. But now it's just become such a, in their mind, a right to just to be able to carry on and do whatever they want in the streets of Prince Rupert. And the more I see, it's the more younger and younger and younger people that are just carrying on and doing what they want to do. Now, there is consequences and there is laws in place already, and I feel that most people in this community would like to see that taken care of.
I can give you some update. The cage that you refer to, the fencing, was actually something that was discussed. We had brought in some community leaders, including Transition House and RCMP, and this had to go back over a year and a half ago. And one of the suggestions in that was exactly what you're seeing, is that there be some sort of fencing erected to keep people from being able to enjoy at least the undercover portion of that. So, and we, so the owner did that very much with our knowledge and I would say our blessing. There are conversations taking place with the new officer in charge. I know that both C.A. Opucci and Deputy Miller are on that. But I do think the suggestion of having him come to council would be a very good one and timely. But I can tell you that the conversations that are already taking place are very much focused on some of that street policing work. And as a new leader in the community, he's got some fresh ideas on how that might be approached. Yeah. I don't know, Deputy Miller, C.A. Opucci, if either of you wanted to make a comment at all. Yeah, okay. Anyone else? I would entertain a motion to adjourn. Councillor Cunningham, Councillor Niche, all in favor? Any opposed? It's carried. Meeting is adjourned.